The authors are from the University of Michigan and Phillips Corporation. These are the disclosures. Umbilical cord volume flow has been considered the holy grail of fetal evaluation. There are quotations in the literature like, "A dream comes true." However, they are often modified by statements such as, "but now for some standardization." The problem is the high variability of the standard volume flow method. The standard spectral Doppler volume flow method relies on certain assumptions that are typically not valid. It requires that the measurement be angle corrected. It assumes that the flow is circularly symmetric. It assumes that the vessel cross-section is a circle, and it assumes that the vessel geometry is time independent, meaning that the cross-sectional area does not change during the cardiac cycle. We have been studying another technique called the Gaussian surface integration method, which makes none of the limitations described above. It's angle independent, it's flow profile independent, it's vessel geometry independent, and it's time dependent, meaning that variations in the cross-sectional area during the cardiac cycle don't affect the measurement. This is a typical display of a 3D acquisition. The upper left-hand image is an acquisition along the length of the umbilical vein and umbilical arteries. The umbilical vein is red and the two umbilical arteries are blue. The transverse image, which would correspond to rotating the probe in a perpendicular orientation, if this were a standard 2D acquisition, it's in the upper right-hand image, and it shows the umbilical vein and the two umbilical arteries. The image of interest is the one in the lower left-hand corner. This is called either the C-plane or C-surface, and it demonstrates the umbilical vein and the two umbilical arteries, but it displays them as if you're looking right down the length or the barrel of the ultrasound beam, and the position produces a surface at constant depth from the transducer. If you take every small area element in the umbilical vein and multiply it times the detected velocity at that point and sum those up, that is volume flow, and that corresponds to the Gaussian surface method. As mentioned, the Gaussian surface method requires a 3D acquisition. In order to do a 3D acquisition, you need either 2D array transducers or you can use a mechanical 3D probe. The mechanical 3D probe works, but the acquisition is slow. So for this study, we used 2D array transducers, and we used either one or both of the transducers listed in any given case. The choice of the transducer depended on the scanning circumstances, typically the depth to the umbilical vein. So the study is a prospective study of 12 subjects. It was IRB approved. All subjects gave written informed consent. They were all high-risk pregnancies. They were gestational ages from 24 weeks to 35 weeks, 5 days. The reason we used high-risk pregnancies were that they were in the hospital and were being monitored for their pregnancies. So they were very willing to participate because they had lots of time on their hands. Also, it didn't matter that they were high-risk pregnancies because we were actually not interested in specifically in the flow rates that we were measuring. We were interested in the variations in the measurements. So if their measurements were high or low relative to normal values, it didn't really matter as part of this study. We performed volume flow estimates at least 3 sites along the umbilical cord using both the Gaussian surface and the spectral Doppler methods. The sites were often not identical because the acquisitions are different, meaning that the Gaussian surface method can acquire umbilical flow at, at odd angles or directly along the flow, whereas the spectral Doppler method required an angle correction. So typically we wanted to acquire at less than 60 degrees. We also needed to be able to measure the diameter of the umbilical vein, and this required the ability to actually see the walls well so we could make the measurement. So at each site, we measured the mean, the standard deviation, the coefficients of variation, which is the standard deviation divided by the mean. The reason we require that is because the variations in the standard deviation could have been due to the fact that the measurements were actually different. And larger measurements could have larger standard deviations. So in order to compensate for the mean measurement, in each case, we use the coefficient of variation. We compared the standard deviations and coefficients of variation using paired t-tests where p less than 0.05 was considered significant. Since we didn't know the correct flows, as I mentioned, we compared the variability of the flow estimates with the method. So this is a table comparing the spectral Doppler measurements and the Gaussian surface measurements. First, you'll notice that the volume flow estimates for the spectral Doppler measurements are higher than the Gaussian surface measurements. However, since we didn't know what the right answer was, we did not compare these two properties. However, the other columns demonstrate the standard deviation and coefficients of variation. Within each cell, you'll notice there's a mean measurement and then an error measurement represented by the standard deviation. So it's plus or minus standard deviation. The comparisons of the variations were statistically significantly different for the spectral Doppler and Gaussian surface measurements. The Gaussian surface measurements were statistically significantly better or less variable than the spectral Doppler measurements for both standard deviation and coefficient of variation. So in conclusion, the Gaussian surface volume flow estimates are approximately 2.5 times less variable based on coefficient of variation than the spectral Doppler estimates. And they are greater than 3 times less variable than the spectral Doppler estimates for standard deviation. Further, although we didn't test this, the Gaussian surface method is much faster and easier to perform than the spectral Doppler measurements. This is because there's no need to do the angle correction measure nor measure the diameter of the umbilical vein. Both of these are tedious and time-consuming maneuvers. So we believe that it's possible that the Gaussian surface method could lead to the umbilical vein volume flow estimates becoming a standard part of fetal assessment. Thank you very much.